Do you know if Dr. Tam is coming, or if he's joining us?
I don't know. They didn't say he didn't.
Okay.
Usually they don't. They do, so he should be joining. Usually they send me an email to say he can't make it, so he didn't. I'm not sure how many people will be here. Susan Melo looked like she was on there, but she's now not. Okay. I'll verify that the mayor's coming in here. Okay? Mm-hmm. Holler if you need me. Okay.
Hey, Susan, how are you? What's that? Okay. Susan, can you hear me?
Yes, I can.
How are you?
I'm fine, thank you. How about you?
I'm great.
Were we supposed to be there?
No,
Okay.
but I am sitting in council chambers for the first time. They told me I could sit in the center seat, but I thought that'd be presumptuous. I thought I'd save that for Ted. Do you know if Dr. Marvel's
Is
coming?
Dr. Marvel going to make it today?
You know what? I didn't hear either way. I was just going to ask you that question.
Oh, it just said Dr. Marvel joined.
Good.
Good.
Hey, Jim, how are you?
Well, hello.
Hello.
Good to see you.
Hey, Patty, how are you?
Hi.
I'm still not 100%. Got a ways to go.
Well, Dr. Marvel, you're not 16 anymore.
That's true.
Takes a while.
I'm trying to get him hooked up on the iPad, but it's not working. So he's on my phone for now.
Yeah.
Hey, Paul.
Hey, Ted, how are you?
I'm good. How are you?
We're good.
Just the four of us so far?
Actually, Susan and
Suzanne's on as
and Jim
well.
on.
Yeah, Anne-Marie's in Colorado still, working her way back.
Good.
So, and here's Ellen Lorraine. So, and we may have a few other people join us. I don't know. How are you today?
I'm good.
Good. Oh, thanks. So have you noticed any change at the hospital?
Oh, yeah. Yeah, definitely.
We'll get into that.
Yeah, unfortunately. So, yeah.
Okay.
So it's 9:31, so we'll go ahead and we'll get
Let's
started.
go ahead and get started, yeah.
Perfect. Good morning, everyone. On the website, there are the minutes from the June meeting. I hope you had a chance to review those. I don't have any corrections. Any sort of motion to approve those or comment about the minutes?
I haven't seen them.
Oh, they should have been sent to you, Susan.
They
Did you-
never are. I hear that every time.
Okay. All right. Dr. Marvel, did you get them?
No.
Okay, then I don't think we can approve them. We'll get them next time. Okay. But I did look at them. They look pretty complete to me. We'll make sure we send them to you today, okay? Thank you.
Okay.
Yeah, thanks. So I guess, as you look in the minutes from the last meeting, we talked about COVID being very stable in June. Things have changed dramatically in the last couple of weeks, both in the state, locally, and certainly in the country. So the CDC changed their recommendations on the 27th of July. There's now a recommendation for masking of even vaccinated people in large public gatherings in areas that are both have high or substantial rates of transmission. The rates of transmission in Delaware initially were high just in Sussex County, but over the weekend they were high again in Newcastle, and now I looked last night, they're high in Kent too, so we're sort of, the entire state is considered of a substantial transmission zone. So I don't know how that's calculated.
I don't, probably based on population. Do you know what our percentage is right now?
Yeah, so the percent positivity rate now, so 2 weeks ago, it was at 1%, it had been at 1% for a while. Last week, it was at 3. It's, in the county, it's 4.8 as of yesterday.
What's in Sussex County?
Correct, yeah, statewide, it's 3.9.
Okay.
So still historically, hey Bob, thanks for joining us. So historically very low, but still, if you look at it over the last week or two, it's certainly climbing. I also saw data from a July 30th release from the Division of Public Health that looked at variants in the state. And they, about 35% of the COVID samples that have been serotyped are one of the variants. There's a bunch of different variants they track. Of that, about half of those variants are Delta virus. So that means that of all the COVID in the state right now, roughly speaking, 17% of that is likely Delta virus, or Delta variant. So what we think we know about Delta, based on what the CDC says, is that it's a much more virulent form of the virus. People that get it tend to be sicker. Unvaccinated people tend to get sicker, and it tends to be more easily transmitted. So we've talked before about the way that this virus is always mutating. The vast majority of the mutations don't work, and they just die out, and nothing happens. But every once in a while, the virus wins the lottery, if you will. And a lottery wants to be two things. It wants to be virulent, and it wants to be able to be easily transmitted. Interesting enough, it doesn't really want to kill its host too quickly because that works against its survival. But this Delta variant seems to have hit those two high points in that it's more virulent and more easily transmitted. So that's the bad news. The good news is that at this point, vaccinated people seem to be doing very well with the Delta variant. In the state, there's less than 1% of the people that have been vaccinated have gotten coronavirus. And of that, just a few, like the few being 22, I think, 22 out of 500 have been hospitalized. So the take-home message with all those numbers and everything is that if you're vaccinated, we're still in a pretty good spot. You should get vaccinated. I think we do have to watch, and it's evolving quickly, and this reminds me of the early days of the initial pandemic where things were changing somewhat rapidly, where we're looking at data, and it'll be interesting to see more and more how the Delta variant affects vaccinated people, if it does, and how it affects, we know how it affects unvaccinated people, but what the impact on the local communities will be. And that's really going to get down to what the overall vaccination rates are in the community. Our vaccination rates are still under 60%, but close to 60% here.
In Lewis, I thought we were one of the highest ones in the state.
In Sussex.
In Sussex, yeah.
So I actually pulled that data specifically. So we're 58.6% in Sussex, of total vaccinated population. So, and that gets a little confusing because that includes citizens under 12 who aren't eligible.
That skews the number somewhat.
It certainly skews it some. When you look at the vaccination rates for our people over 65, it's much higher, which is good.
I think we're like close to 80 is what I've been hearing.
That's what I remember reading, yeah.
Okay.
So it is, as much as the last time we met, COVID was a very stable topic, it's now become a very dynamic topic almost day to day, trying to look at additional data to see what what's the best approach.
So bringing it to BB, are we seeing you have an increase in hospitalization? I've been hearing that most people are not hospitalized at this point, but I don't know. What's BB's situation?
So that's the most important thing is most of the people that are here that are COVID positive are not getting hospitalized right now. Our numbers are really low relative to historic numbers, which is good. But we are still seeing some, and we're seeing some breakthrough cases. So it's definitely out there. There's some pockets around the country where the incidence of people that have been vaccinated who then get COVID has been a little higher. So it'll be interesting to see kind of what's unique about those communities. That's really something I'm looking forward to over the next couple of weeks to kind of keep an eye on.
Yeah. Everyone's read about the article in the New York Times or the Washington Post about what happened in Provincetown over 4th of July and how obviously it was a party town, it was a holiday, and people threw sort of caution to the wind, and there's now a very large number of people that have contracted with a positive for COVID, but whether they were vaccinated or not.
So that's Barnstable County, right?
Yes.
Okay, so I didn't recognize the town, I recognize the county, and I've read that. Yeah, it'll be interesting to see, sort of as they unwind that, because that's obviously a population that likely traveled there. So where did they come from? And it's also somewhat unusual. I have no idea what went on from an activity standpoint, but generally speaking, in the summertime, you think about activities being outside, which we know is generally pretty safe. So that'll be interesting. That's actually, that is the exact area that I'm kind of watching to look for more information. But I think the take-home message is that the vaccine is still very effective against the Delta variant, and it continues to be safe. I can't overstate that enough. That is, every week, every month goes by, the vaccine continues to be exactly what we thought it was, with a very low side effect profile, and it's safe, and quite frankly, we need people to get it. The more people to get it, the better. You know, I was thinking early in the pandemic, this was very much a question of, well, not only the pandemic, but when the vaccine came out, it became a question of safety and personal choice, and I certainly get all that, but at some point, this also becomes a matter of your community. There's more of a benefit to get the vaccine than just what it does for you, and even for you or your family, but it's for the community at large. And that's, I think, sort of the messaging that I think people haven't got.
And they haven't caught on, yeah.
I think about the days after 9/11, if people thought that vaccine would create the national safety that we all yearned for after 9/11, we would have a much higher vaccination rate. But this has sort of unfortunately been messaged a little bit differently over the last year or so. The vaccines, I guess, are 10 months old now. So, yeah.
So bringing it down to local level again, has BB changed their policy on visitation or anything like that as a result of this uptick?
We haven't, because the uptick remains very small at this point. Bill Chasnoff, who's our lead on this, our infectious disease lead, is obviously watching the data very closely. And we certainly will change likely our visitor policy if we need to, but we're not at that point yet, and hopefully we won't get there. Just as a quick plug, we understand that it's really hard and sometimes harmful for patients not to have family to advocate for them. So not only is there a psychosocial part of having somebody you love being there, but there's just somebody who's sort of there to advocate for you, who can add to history and stuff. We understand how important that is, so we'll be slow to do that. Hopefully we won't have to.
I see where, like when I go to the grocery store, whether it's Weis or Giant or whatever, I see a lot more people wearing masks, and we understand that some commercial operations, whether it's any of the big box stores, are beginning to require it. Is that something that you all are recommending, or is it still pretty much on a comfort level? Do you think the community needs to go back to a mask wearing requirement for indoors?
Well, first of all, I'm not speaking for the hospital.
Of course not.
But I will say that in healthcare settings, we never stop wearing masks.
Of course.
So we've been wearing them the whole time. The recommendation from the CDC is just a recommendation, not a mandate. And what's difficult to define is what is a, quote, large public setting? Like kind of what does that mean? Does that mean 10 people in a room? Does it mean 1,000 people in a room? Kind of what's it mean? So I think it's going to be so much of an individual choice moving forward, at least in the next few weeks. With the rate of infection climb significantly, then I think you'll probably see some of maybe the larger stores begin to ask people to use masks, would be my guess. I spoke to someone from the Division of Public Health, and I asked about the state if they thought there was going to be another state mandate, a mask mandate, and they pointed out that the only way the state could do that is if there was another state of emergency. Correct. And at this point, there's not talk of that. So I do think this is going to come down to sort of, at this point, sort of a personal choice.
Yeah, that's kind of what I understood, is it had to be, the governor would have to have another state of emergency, and I think he'd be reluctant to do that unless, the incident picks up dramatically.
Yeah, but again, the numbers are changing very dynamically. Sure. Not dramatically, but dynamically. If you look at them, they're doubling every day or two or whatever. But the numbers still remain low. So hopefully they'll stay at a lower level.
I think what we're seeing, at least in the national news, is that there are certain states that are particularly having greater numbers that represent a significant percentage of the number of people who are becoming positive.
And I think those are states that have a lower vaccination rate,
Exactly.
which makes perfect sense, especially, here in Delaware, in particular Sussex County, in particular Lewis, our most vulnerable portions of our community are the best vaccinated, which is the best news. But I can't imagine having this more transmissible variant in a community where you have low vaccination rates and you're really vulnerable people. I mean, that would be, and I think that's kind of what we're seeing around the country in those hot spots.
So Fauci has mentioned the idea of a booster shot or something like that. What are you hearing through your medical channels about, I think what we've heard is, what I recall hearing from Dr. Fauci was, something in September, there might be, the possibility of a release of a booster shot, or some kind of determination made about whether that was going to happen or not.
Yeah, so I don't have any hard date on that. I do know that Pfizer is studying a third dose, and I think that Moderna is. My brother is a Pfizer study participant. He received, the original 2 doses. I think he actually started a year ago now, and he received a third dose, or the booster shot, maybe 6 or 8 weeks ago now. By the way, he did really well with it, no symptoms or whatever. So I do know from a company standpoint, they are looking at it. The interesting thing that I don't know is I don't know how the booster is different. So I don't know, each year the influenza vaccine is different than the year before. So I assume the booster is different and designed to be a little more effective against some of the variants that have, which is different than just receiving a third shot. Because I've had questions from people, do you think I should just get a third shot? And I don't think anyone has looked at that that I'm aware of. So, but the short answer is I do think that third shots are coming. I was hoping that in the state that our vaccination rates would tick up just in the last couple of weeks, and they really haven't changed much. I mean, we're still kind of, vaccinating some people, but not a huge amount more than what we were, say, a month ago.
So you're not seeing more people coming in to get vaccinated? Of course, now vaccinations are available pretty broadly, so you can get them at your pharmacy, you can get them at a grocery store, you can get them in your doctor's office maybe.
Yeah, so I asked that question to Public Health, and they said that they're seeing a small uptick, but not a dramatic uptick in the vaccination rates in the last few weeks. So, and they would be aware of like all of those vaccination points. So it hasn't changed a whole lot.
Okay. Well, we're having our Policeman's Night Out tonight, which is obviously an open-air event in George Smith Park. And, obviously, we worked with DPH, and we're going to offer both vaccinations and testing there. And we'll see what happens there in terms of, we've never done anything like this before at a night out. Of course, there's never been a reason to, but hopefully we'll see just how receptive people are. And I was just talking to Glenn Marshall before and he was saying, the one thing is we provide an opportunity for people to ask questions and get more information, and that seems to be the biggest issue What I'm hearing is people still have these uncertainties that they're wrestling with, and those who are not vaccinated.
Yeah, I agree. They have questions and they have some misconceptions which are difficult to sort of, unwind, if you will. But hopefully, as this becomes more, the other thing that happened is in June and really most of July, COVID became a second-tier story. We had everything else to talk about, and now it's back in the public consciousness, and really kind of not unexpected, because as we get towards fall, like we knew there's a question of schools and that kind of stuff. So, which is a great segue. I always love to hear what's going on. Bob, how are you doing?
Doing very well, thank you. Summer's definitely flying by. It seems like the students just, last school year, the students just left a couple days ago, and it's been now over a month ago. We're just finishing up our summer school efforts, and we made the decision when, as recent updates came out from the CDC, not to change any of our protocols for the summer, just to keep them in place, and then to make a decision closer to the start of the school year for how we would proceed in the fall with masks or not, and for which students, if those kind of things. I think things are most likely we could receive several more updates before the start of the school year, which for us is the latest it's going to be, which is, I think, September 8th. That's the Wednesday after Labor Day. So we're kind of holding tight, looking at data every day, as I have been doing for the last year and a half, and making a decision sometime towards the center in the middle of August. We do have a Board of Education meeting planned for the 19th. We moved that date 1 week earlier for this purpose, so that we could we could convene our Board of Education earlier than we normally would have, just to have this discussion and for me to present information to our board and make some recommendations for the school year. But regardless of sort of what the recommendation is and the action is, I see that sort of being fluid as well, based on data, based on the CDC, based on the state and the governor and any, subsequent, state emergencies, those kind of things. So it's sort of right now, it's just a holding pattern. We like was said earlier, we are seeing an uptick in the numbers in our communities, like the zip codes that make up our district, but not large numbers. We're averaging right now 5 cases per day in the Milton zip code, Lewis, and Rehoboth zip codes combined. That's compared to 40 cases per day during parts of last school year.
So are those people that touch the school district, or are they just students?
Anybody lives within the district. So it's anybody lives in the 7-1, 6-8, or 5-8 zip codes.
Okay.
So I combine them every day and look at that data just to see some trends, and I compare that data to Sussex County to see sort of where we are. And we're definitely in a better position than the county as a whole with the numbers and increases from last week to this week. This week it's averaging about 5 cases per day. Last week was 4 cases per day. So not a huge increase. In Sussex County, I think last week they were averaging like 13 a day, now it's 21 a day. So that's obviously based on the fact that we have a much higher vaccination rate in the zip codes that make up our district compared to the rest of the county as a whole.
Yeah, I would caution you to, as you look at those numbers, they're perfect to look at a trend, but to not look at the numbers themselves as hard data. Just the thought is that lots of vaccinated people, if they have symptoms, have very mild symptoms or no symptoms, so they may not get tested. If you think about last summer with, all the young people that were in Dewey that were COVID positive, the vast majority of them weren't sick. They just knew somebody who was sick and they got tested because it was around. So when you see those numbers of like 4 and 5 a day, that actually may be greater than that. But but still low numbers and most importantly, not really sick. If you remember, if we go back to the very first weeks and months of COVID, a lot of this restriction stuff was about not overwhelming the healthcare system. Like, I don't think we ever had a reasonable vision of saying we are going to eradicate COVID. So when you have people that are sick but they're not being hospitalized, you can certainly live with it. We deal with that every year with influenza, and at the end of the day, with influenza for the year, we don't really care how many people get it. We do, but we don't. We care how many people are hospitalized and ultimately succumb to it. So, it's always just a matter of perspective. So just from my own curiosity, Bob, so the decision to mask or not mask and all those kind of things, does that lie with you, or does that lie with the board, or shared?
It will be a recommendation from me and a decision or a vote from our Board of Education. It doesn't need to be that way, but we've chosen to do it that way here. It could just be the superintendent's decision if the board chooses not to be involved, but our board will be involved and want to be involved with that decision, which is great. So it'll be, information that they receive. It'll be a presentation that I make, it'll be a recommendation that I make to our board, sort of how to proceed in the fall.
Okay.
We also are working on a campaign to get the word out about the importance of vaccinations, and are also organizing several more vaccination opportunities for students, families, in the community prior to the start of the school year, and stressing the importance of vaccinations in this whole process forward. And not just to lower the numbers of anybody getting COVID, but the quarantining part of it as well. If we are back in school, whether students are masked or not, or staff are or not, the idea is if you are vaccinated, that currently right now there would be less chance that you'll have to quarantine. And that's one of our larger concerns as well, that if we do have cases, there's a chance that there'd be several quarantines go along with that. Even if you're masked, if you aren't masked, it could be classrooms at a time. If there's not a mask, just not aren't students in the classroom wearing masks. So that's a concern of ours, that we'll have more quarantines if that is the case. So we're trying to stress that and make sure everyone understands what the situation is.
Do you roughly know what your vaccination rate is of your employees, the district?
Do not have a exact idea. The number is most likely over 50%, over 70%, possibly too. We haven't asked that question of our employees yet. Sure. Kind of leaving a little more time than making a decision how to handle that and the best way to collect that. It's information that we can ask. It doesn't have to be answered. And if there are cases in the schools or classrooms, then we would ask, obviously, anybody that was involved through the contact tracing protocols if they were vaccinated, because that would determine, a lot of times whether or not they're quarantined. Thanks.
Yeah. So if I can help in any way in August, let me know. If you'd like me to kind of help support your presentation to the board or anything.
That'd be great. Thank you.
I'm not looking for any more work, but it seems like an important thing.
No, very important, and we made the announcement. We're going to, if nothing else changes, bring every student back, and then now it's just the idea of the masking part of it and how that's going to look. Right now, with any transportation, that's mandated still, but other than that, it's not. It's completely up to each district how to handle that. So.
You did bring up an interesting comment with regards to employers. Some of the big tech firms and some of the financial firms are going to require that all of their employees that are in person are going to be vaccinated. We'll see how that kind of plays out. The FDA thinks that they will have full approval of the vaccine sometime in September, and that makes it a little bit easier for a company who wants to mandate, or an organization to mandate, that their people are vaccinated. So, yeah, it'll be interesting. It'll be interesting to see if the state of Delaware says they want their employees vaccinated, or if any of the healthcare systems do that.
I've been monitoring some of the things going on in Washington, and the mayor there, Muriel Bowser, has just required any indoor activity wear face masks.
For employees or in the city in general?
City in general.
Yeah.
So whether you're in a grocery store or, something lower. And so I don't know if I don't know that the governor will get to that point, but it is something that's being done in major metropolitan areas.
So, as the mayor here, could you do that, or would you need to have would you have to have a declaration of emergency for that?
Well, what we opted to do was follow the governor's guidelines. We looked at that initially, and then we adopted, with council's approval, a more restrictive requirement of wearing masks in the downtown commercial area and at the beach area last year. And then we rescinded that ahead of what the governor was doing with state of emergency, because our vaccination rate had risen. So we could go back to that. At this point, I think, we're not there yet, but it could happen. We still are requiring people to wear masks when they come into the building here, initially, and then, and we're obviously still doing Zoom meetings and live streaming, and so those are some things, but we have not gotten to that point yet. We could.
Yeah. I hope not.
I hope not too, yeah.
I guess from a political/logistical standpoint, you'd almost need to have the other towns around here on lockstep.
I have not spoken with Mayor Mills in Rehoboth yet, but I would imagine they followed us in many ways, or we followed them with similar kinds of requirements. A question that came in while we've been sitting here talking was, have you heard anything about the number of people who have succumbed to the Delta variant but were vaccinated? Has there been any statistic on that?
Yes.
I do know of one person who was in a social situation who tested positive, and yet they were vaccinated, about 3 months ago.
So just data that was released from the state. So this is to date through since the vaccine has been out, there have been 567 breakthrough cases out of setting of almost 500,000 fully vaccinated. So that's a 1% breakthrough. And of that 567, there was 22 total 8 fatalities.
8 fatalities.
However, there's an asterisk with that, and they're not sure that so they recognize those people had COVID and died, but they don't know for sure that they died from COVID, meaning they may have had like a heart attack or something
Underlying
else.
conditions, yeah.
Yes, they would have to dig more into that. So, but low numbers, when you really kind of begin to peel back the number of people that have been vaccinated. So again, still really safe. And I tell people all the time, these numbers are not unlike the numbers that we use when we make a decision to give somebody an antibiotic. I mean, they're not significant, but there are risk of anaphylaxis and death related to antibiotic use. Happen really, really rarely. But those are the sort of things that are in my mind every time I write an antibiotic. Same sort of rates here.
Yeah.
So really, really infrequent, but it can happen.
Well, that's good information to have. So,
Yeah.
okay,
But by the way, those numbers I gave you were from the state of Delaware.
great. That's very helpful information.
Yep.
So, Dr. Marvel, you have any questions?
I'm just a little concerned about the politics involved with the mask recommendations and mandates. I think the thing we have to think and keep in mind is that a mask beats a ventilator any day of the week. So, I don't know that it makes a whole lot of difference about the policies. I think people just have to realize that this is a protective measure, and it's not a punishment. It's a protective measure, and it's not just for you, it's for others around you. So it's a public health issue, not a political issue.
Yeah, I think that's the point Dr. Cowan was trying to make, that you're doing it not only for yourself, but for your community.
Yeah. Yeah, it's difficult. And, there's two kinds of people that don't wear masks. There are the people that are somehow fundamentally opposed to it for whatever ideologic reason. And then there's the rest of us that are just fatigued by it. And you just sort of you're just not as vigilant as what you have been at some other point during the pandemic. And that's just 100% natural. So you need to kind of remind yourself and think about those things. I have to admit, a few weeks ago, I didn't think much about it. Now, when I'm in crowded spaces, it's in my mind a little bit more than what it was.
It's disturbing to see the number of incidents that are occurring in our airline industry regarding mask wearing. Apparently, there's a very high number of unruly episodes on airplanes regarding mask wearing. I haven't been flying lately, but apparently this is happening, and it's being reported, and some of them are rather violent. One airline attendant was punched in the mouth and several teeth knocked out. I think that's just totally uncalled for. I think that sort of thing is only going to get worse if we don't somehow rather make it an issue, make it known that it really protects not just you, but the others around you. But some people don't care.
Well, unfortunately,
It's not going to change.
you can't mandate civility.
Right.
And at the end of the day, that's really, civility. You make a good point, Jim, with regards to airplanes in general. So the airline industry has done a good job now of recirculating the air more frequently. And I forget the exact numbers, but they turn the air over much more frequently now than they used to. But, there's really, from getting a viral illness standpoint, getting in an airplane is really dangerous for that. I see people all the time that typically it's a very minor virus, but they'll tell you they've been on a plane for a while and they come back and they've got a cough and that kind of stuff. And if you think about it, if you sit with 60 or 70 other people in a little aluminum tube for a couple hours, it's no surprise that it's the exact opposite of the reason why being outside keeps us from getting the virus. It just doesn't circulate enough. So, my gosh, if there's any place that you want to have a mask on, it's in an airplane for a lot of reasons.
Susan, you have anything?
I just wonder if there's any more information about children under 12, getting the vaccination.
So I don't know for sure. I think it's being studied. I don't know if, Bob, if you have heard anything from your end about it. But still, certainly not approved for it, and I don't know the status of that.
I do not either. I know we aren't expecting anything to occur for the fall. Possibly during the next school year, there's a possibility there could be a vaccination available from what we're hearing, but nothing that we're going to kind of get on for September of 21.
Do all children who are vaccinated need their parents' permission to do so?
If they aren't 18, yes.
Yeah.
Even if a child shows up at a vaccination center,
Yes.
they can't ask for it themselves.
Yep.
If they're under the age of 18?
We wouldn't provide that opportunity for anybody at any of our vaccination clinics. Parent would have to be, involved in there.
Right.
So it's not just the children, it's the adults that we have to convince as well.
Yes. Yes.
Yep.
Well, I think everybody's trying to be cautious for the most part, but there's this Delta variant that's roaming around, and we said,
Yeah, I think the numbers to watch are obviously our infectivity rate locally, and then the numbers under that will see what the Delta variant in the state is, how it goes up.
I've noticed in the last week I've seen more young children, looks like they're 8 and under wearing masks with parents, even if the parents aren't, you know. So from that standpoint,
Maybe it's a fashion statement.
well, they certainly have come out with masks of every variety, whether, you know,
Right.
advertising properties or advertising a business, whatever. But it was funny, last night there was a piece on the news about, they were interviewing some shopkeeper who had said because, you know, in early July, they moved their masks to the back of the store because they weren't selling it. Now they've moved them back to the front of the store. And I think,
That's true.
you know,
Yeah. Same thing, I was in Walmart in July, and I saw this pile of the boxes of masks that was, 8 feet tall or something like that, and they weren't selling it all. I'm sure now they're a little hotter again.
yep. I know I drive around with a package of them in my car.
That's true. We were in Dover yesterday, and now Boscov's now has a sign that they're I don't think they're mandating masks, they're requesting. I guess they're mandating it, that you wear a mask in the store.
Interesting. I hadn't seen any businesses that have mandated it.
No. Certainly medical offices, but, I was in an eye exam yesterday, and they were requiring them.
Yeah. So like I said, we have not gone away from them, so.
Okay. All right. Anne Marie's coming back from Colorado today. She sent me a note that she's not, after our conversation, she's not super excited about getting on a plane.
Oh, gosh, I'm sorry. Wear your mask. Keep it on.
That's what I wrote back, was wear your mask. So,
Although, in truth, the airlines have done a much better job of the frequency in which the air is recirculated.
Right,
So that makes a big difference. But still, yeah, you'd want to wear a mask.
okay.
Yep.
Well, I think it's one of these things we just all have to stay vigilant on and monitor what's going,
Yep. Okay.
Okay, Ellen Ray, did you have any questions before we?
We discussed it, thank you.
Okay, great. All right, should we set a date to get back together? Given the fact the school system's starting, and you said you have your meeting on the 19th, Bob, is that right?
Correct.
Would it be helpful if we got together the last week in August? Would that work for you? Or
Bob, you said the school board meeting's on the 19th of August?
That's correct, yep, yes.
you could even do it like that's Tuesday, the 31st of August. That's just before Labor Day. Does that work for you?
Oh, that's fine, yeah.
Okay. Is 9:30 still good?
Yep.
Okay. That work for you, Bob?
It does, yes. 9:30 on you said the 31st?
Yes.
Works for me.
Great. And hopefully it works for you, Dr. Marvel.
Yes, I think so.
Okay. Good. Great. All right.
What day of the week is that?
That's a Tuesday.
Tuesday.
Okay.
Okay. Very good.
All right, thank you.
Thank you very much.
Yep.
Have a good day, guys.
Thank you.
Thank you.
All right, have a good day.
Right,
We'll get you those minutes from the last meeting.
right.
They are posted on the website, but we'll send you directly, okay?
Thank you.
Thanks.
Okay, thank you.
Thank you, Christine. Monitor extraordinaire. So thank you very much for coming.
Yeah,
And,
absolutely.
I'm glad we scheduled this meeting, because last week we were like, do we need to schedule another meeting?
Yeah.
And I'm glad we scheduled this one, because obviously apprehension has picked up a little bit.
Oh, sure.
It's so
And
strange.
for good reason.
Is it? Okay, that's
I
fine.
don't know how to turn that off, just so you don't,
Okay.
yeah.
No, it's definitely the data's changing like almost every day. So this is perfect timing, and actually, by the end of the month, it'll be different also, so it'll be helpful to see. Thank you.
Thank you very much. So, all right. Is David back?
Yes. Yep. I'm actually surprised he didn't join us.
Well, he's probably got another 1,000 other things he's dealing with today.
Oh my gosh, the guy is,
The energy bunny.
he really is, and I say to him all the time, like, this is a marathon, not a sprint. Like I need you with your same energy level 5 years from now, so don't kill yourself. Although I don't think a guy like that really, I don't think he has any other gear. He's all in.
That's been my perception.
Yeah, which is really, really great.
Well, it's great for the hospital.
It really is.
Yeah, that's really good. Anyway, well, again, I appreciate